Hey, Gaynor.
Hi, Lauren.
How are you?
I'm very good. It's work this time.
Yay. We have so many people, we have had so many people write into me, so excited about this conversation. I think there's a lot of people who don't know what a pessary even is. So just to bring people up to speed, I'm going to give like my definition of a pessary. So just for people who don't know what a pessary is, it's an intravaginal device. So something you insert inside your vagina. And it can be shaped like a cube. It can be shaped like a tampon. Correct me if I'm wrong anywhere here. And the purpose of the pessary is it's used for either incontinence and or prolapse. And a lot of people don't know that there's even a treatment called a pessary. And a lot of people are also, they struggle to find the right fit with a pessary. A lot of people I work with give up really fast, or the pessary works in one way, but it doesn't work like when they start to go running or whatever. So we wanted to kind of talk about pessaries and how they work, why they work, or do they work, or should we use them, and what's the best practices. I know, Gaynor, you are, so you can tell us. I would love to get a quick intro. We spoke a few months ago and then our conversation was a little truncated. So we're just picking up where our last conversation left off. So why don't you just tell our audience like a little bit more about you and why you're so interested and invested in pessaries, and then we'll start from there.
Oh, thanks, Lauren. Thanks for inviting me on. I appreciate it. So basically, in a nutshell, my own mother suffered with stress incontinence and she was never given any kind of exercise. And bearing in mind, we were both nurses and she went to the doctor, had the surgery. Surgery worked for a while, back in incontinence, became depressed, tried to take her own life because of the depression. They were treating her just for depression and not the root cause. Together, we invented a pessary that went global, and Mum sadly passed away in 2004, just before the clinical trial data came to publish. And so I vowed from then that no other daughter, no other mother should ever, ever have to go through the pain, the anguish, the anxiety, the despondency of being incontinent or suffering with prolapse. I suffered with a prolapse and I've reversed the prolapse. So for everybody who's watching, there is absolute help available out there. There are techniques out there that can help reduce prolapses. And exercise and pessaries are, for me, one of the main things that I think should be talked about and considered, certainly before surgery. I'm not against surgery by any means, but I think it should be the last option on the package.
Yeah, and I think that it's amazing that you reversed your own prolapse, because I get so many people every single day saying, I've been told by my doctor that because I'm postmenopausal or I'm over the age of 40, that my prolapse won't resolve. And I think people think that postmenopause females are less likely to be able to resolve a prolapse. But you and I have both seen it happen. It happened for you. You resolved your prolapse postmenopause. Isn't that right? You were postmenopause.
Yeah. I was in my 40s. I hit perimenopause quite early in my life. So yeah, and I've seen it with my own clients as well. They've reversed the prolapse. We know already, because of estrogen, the depletion that affects the muscles, but also, yeah, we're not going to build up muscle fiber like we were in our 20s, but there is evidence out there showing that exercise can build up muscle fiber, regardless what age.
I mean, absolutely. That is the whole thing about muscle and strength training, and muscle does adapt. And, it's even more crucial to actually have really strong muscles postmenopausal, because with the loss of estrogen, the muscles are crucial to bone health and even brain health and metabolic health. And so it's really important, and you absolutely can build up muscle after menopause. So I'm just looking at my notes because I was like, I want to make sure. So you trained in the Restore Your Core teacher training, and I feel like your work, so you work a lot with helping people find the right pessary. But what I feel like a lot of people do, even an email I just got, I sent her, I was like, you need to talk to Gaynor Morgan instead. Or also, I send everybody pessary related your way. But I do feel like a lot of people think that it's like, I'm just going to put a pessary in and I'm going to do nothing else, right? Or their provider is not saying the pessary will work best when you are also working on your pelvic floor muscle. Like it's not like replacement therapy, the pessary. It's not replacement therapy. You've got to be, and I feel like that was your experience with it as well.
Yeah. Yeah. I think, when you think about it, we go out, anybody who cycles a lot, what do you wear? You wear cycling shorts because they're a great support, certainly for, the perineum area. When we do gym, we use Pilates balls as, a support or a tool. We use yoga blocks as a tool. We need to modify. We wear support underwear. These are all tools, and a pessary is nothing more than a tool to mitigate the symptoms that you're experiencing. Now, if you just leave the pessary in and think, well, that's it, don't expect the body to be compliant with, that rebound of the muscles, because the body muscles will think, oh, well, that's all I got to do is just hang here. And then when they take the pessary out, I've got the prolapse is back again, maybe a worse, because also we need to start moving. And in movement classes, don't forget, it's not just about the muscles. We need to strengthen the ligaments and the tendons. And there's a heap of ligaments in the pelvic floor that attach, the bone to the bone. And then the pelvic floor comes, the muscles come, under. And all of a sudden, we've so focused on let's strengthen the pelvic floor, we forget about the ligaments, that maybe those are the reason that the organs have descended. So with a pessary, you can insert a pessary. So this is a urethral ring here. So this is just, it'll support a moderate prolapse, but the little knob on the side here, so this is one by Med Design, this will push the urethra and close the urethra in cases of involuntary incontinence, so urinary stress incontinence. So again, one of the things that certainly I've learned through the progress of being an instructor, and I had my aha moment during the training with Restore Your Core, when we were looking at body patterns. And I know, Lauren, you're a huge fan of looking at those body patterns. Where are we looking? What's going on with the body here? How can we correct them to sort of then, improve our health? And as I was looking at you doing the particular course this day, I thought, well, I've got a eureka moment here. This is why so many people struggle with the pessary during movement classes, because their patterns are all wrong to start with. Yeah. It isn't about the pessary, it's about them in their own body. Yeah. And this is why, people with a prolapse and a hypertonic pelvic floor will often even push out a tampon. Anything you insert into the vaginal canal when there is a pre-existing tension or a gripping or a injury, most likely the vaginal canal is, there's going to be so much pressure that it's going to be pushing out that object or tightening around it really hard, and it's not going to feel good. So a lot of people will say, I used a pessary, but it was so painful. And it's not that the pessary itself is the problem, right? Sometimes it is, the fit is all wrong, but oftentimes what's happening is that the muscles are so tight that it's creating that grip around the pessary, which is very uncomfortable. Yeah, I think as well, a lot of, so one of the things that I would suggest that if you are hypertonic in any way, down train the pelvic floor first. And there's a lot of great things that you can do. For instance, dilators are a great way to sort of relax, get to trigger points. Always talk to your physiotherapist first. Don't go off because you may not know where your own trigger points are. So working with a professional on the internal side, being taught how to down train by deep stretching as well. So there's a lot of things we can do to help ourselves, and then maybe start with the pessary as you start back to up train the pelvic floor. So one of the things is it's vaginismus is a contraindication for pessary because you're not going to get the pessary in through the introitus anyway. But dyspareunia, then I would say, again, depending on the person, but we find a lot of people that are gripping, and don't forget that we can grip on one side and be very lax on the other.
Yes.
So then as you move, as we tend to move, and again, I always refer back to the stone in the shoe. It affects our gait. If you've got a little stone and you can't get it out of your trainer and you want to carry on running or whatever, your gait starts to change. It's the same with the pessary. When you're pushing on tightened muscle, this can cause scar tissue, adhesions. So your body's really, really clever because it will try to find the shortest direction to get to where it needs to be. And if that means moving the hips, maybe the right hip forward to mitigate that pain, then that's what it will do. But unfortunately, muscles remember things, and that's how you're going to stay in that pattern. So let's get to the root cause. Talk to your movement instructor, have them assess what's going on. And I think one thing for all movement instructors, and I had a brilliant course, and Gemma was on my course as well. We had so many aha moments. And I think with movement instructors as well, when you're assessing somebody, always ask if they're wearing a pessary, because that's something that they may not voluntarily give the information to you. So you're kind of looking, there's a hip hike here and left shoulder's down a little bit, okay. And the solution might be as simple as, how about taking your pessary out for this movement class? Let's see how you go there.
Yeah. And I think so for people listening who may not be kind of following all of that, was a lot of information, which was wonderful.
Sorry.
No, it was wonderful. But what Gaynor is saying is that, for example, like in Gaynor, you did your movement training with the Restore Your Core training, which is the training I offer. So when people go through that training, you learn to look at them posturally, even though we don't automatically assign your right hip is higher than your left. We don't automatically say, oh, that's going to create pelvic floor dysfunction. We don't do that correlation, but we are looking for patterns in the body that can create referred patterns into the pelvic floor. So a lot of people don't realize that, because a lot of us have been trained to believe that the pelvic floor is very isolated, and that what happens inside the pelvic floor is just kind of this bundle of muscles and tissues that are kind of just behaving on their own inside. And it's hard for people to understand that your pelvis affects your pelvic floor. One side being higher than the other affects your pelvic floor. One glute being more active. So if there's a pelvic twist, one foot turning out more than the other when you walk is going to affect how you push through that leg. So all of that can affect the pelvic floor. And I think you have found in your work is that even just assessing somebody's internal and external rotation of their femur, so the femur is the thigh, the hip, and assessing, a lot of people lack rotation. They are more predominantly hanging out in one rotation over the other. And that working on just their rotation can really help not only their prolapse, and their hypertonic pelvic floor, but it can also make pessary use so much more successful. Is that
absolutely
what you found?
Definitely. And I think the other thing that I found as well is that so you can get referred pain from the pelvic floor to the hip, for instance. So a lot of people go, I've got hip problems. and that's not to say they genuinely haven't got hip problems, but a lot of time they're getting treated for the hip and having surgery and thinking, I've still got the pain in the hip. And when you look deeper into the pelvic floor, 9 times out of 10 in my experience, when we've worked on that obturator internus muscle, which is part of the wall of the pelvic floor, then the hip pain tends to dissipate. But if you've got a pessary that is aggravating that particular muscle, nothing's going to help it. We need to either change the shape of the pessary. So, for instance, this is a dish pessary. So I'm going to show a couple of pessaries, if that's okay, so people...
Sure, that is a great idea.
So again, you know, the dish or the cup pessaries, they've got this nice curvature. Now, what I like about these, if you've got a rectocele, so that's where the bowel starts to herniate into the posterior part of the vaginal wall, a ring pessary usually will just cut into that wall, and you, 9 times out of 10, if it's in a certain area of the bowel, then you'll have problems defecating. So my suggestion would be always to go for something with a little bit of a curvature. And as you can see, look how soft that is. So, you know, you're supporting the organs there. For sports people and people who just want pessary, then at the moment, the tube seems to be the favourite product. So this takes a little bit of getting used to, but it is fantastic. You remove it daily. There's a lot of doctors out there saying you remove it 3 monthly. Absolutely not. It's to be removed on a daily basis unless the manufacturer has given written permission, and then it can maximum 3 days, but no more than that. So with the cube pessary in situ, so my recommendation as well is always to push that prolapse up first. Don't try and insert a pessary while the prolapse is down. So lie down if you can for 15 minutes, legs in a V up the wall, knees slightly bent, do some deep breathing, get that diaphragm to work properly. So, you know, you're massaging the organs below the diaphragm, and then either take, you know, you can use it with your finger, take a dilator, I've got one of these dilators here, push those prolapses up first, and then water-based lubricant only, never oil on silicone, and then pop your pessary in. Your pessary will be your best friend for that exercise class. If you don't push the prolapses up first, what can happen is that the prolapse, so this is a Gellhorn, the prolapse can actually sit below the pessary, and then it can either cause pinching or it just is very uncomfortable. So always pop that prolapse up so the pessary does the job of supporting the prolapse properly.
That's amazing. I love how you instruct first to lie down, relax your body, work on the muscular system, and then bring the pessary. And do you find that, so do you recommend, somebody was asking in the questions, when you were talking before about the assessment part, always ask someone if they're wearing a pessary when you do an assessment. The person was asking, like, why would you do that? Why are we asking people when we're doing an assessment if they are wearing a pessary or not?
So again, it's absolutely, I've got a form that I get patients or clients to fill out. It is not, you know, you don't have to fill out anything if you don't want to. And I don't want anybody to ever feel uncomfortable answering any questions that I ask them. But, you know, the more information that I have as a trainer, the better equipped I am looking at my client going, okay, she needs a modification here. Let's not go down this route of doing, let's say, a squat in this way. Let's get a ball behind her back, get her against the wall, simply because I know she's got the pessary. I know that doing a squat or a certain way, a lunge, maybe with a twist, already if she's told me that she's got a pessary, and I can see that when she's doing those movements, it's not her, but it could be the pessary that's causing those body patterns. So if a movement instructor is equipped already with the information, she knows how to modify your class for you. So it makes it a lot easier. And also the pessary has to move with the body. We're not 2D diagrams that we see in a book. So again, with the experience of your movement teacher, she can go, right, okay, I know that she's kind of struggling on the left side, so let's work in a different way on the left side to the right side. And then what I find is that you get clients more compliant. They want to work, and they see the improvements there.
Yeah. One thing I found for people who have a pessary and they are doing Restore Your Core or they are doing private lessons with me is that when they learn to stop bearing down all the time, it makes a massive difference. It is a huge aha moment for them. So I think that what people with hypertonic pelvic floor or prolapse or incontinence don't realize is that they might be bearing down all the time into their pelvic floor. And when you have a pattern like bearing down into your pelvic floor, you probably don't feel it yourself. You need a good assessment. You need someone to help you figure that out because you're so used to doing it that your brain and body don't recognize it as a foreign behavior. If somebody always holds their head like this, then they're not going to notice that they're doing it all the time because it feels so normal to them. And so when people are constantly bearing down, they don't know that they're doing that. And then they suddenly have this aha moment when they learn to stop bearing down. Their pessary is no longer a nuisance to them. And it's like all you had to do was learn to stop bearing down. And why didn't I know that before? People always say to me, I could have saved myself so much heartache and years of like feeling so frustrated and like nothing could help me. But actually, once I learned that I was bearing down constantly and I stopped bearing down, my pessary worked for me and my prolapse got better. I'm curious if you see the same thing with your practice because you work so much with people with pessaries.
Yeah, absolutely. I see it every time. And also the breathing as well, because a lot of people, they get hung up on belly breathing. And, they say, should I be 360 breathing or belly breathing? Well, all breathing is 360 because you breathe sideways, frontways, and the back. So I think what we're looking at when we're breathing as well is the diaphragm can descend down 10 centimeters. So that's a long way. A lot of people with pessaries, because they're trying to hold on to the pessary subconsciously, they're breathing shallow. So their diaphragm isn't really getting down. And this is where exactly what you're saying, Lauren, is that subconsciously they'll start bearing down. So it's really important before we start any sort of movements is to get the breathing right. Once you get your breathing right, everything else tends to fall into place a lot easier. The body accepts a lot of the movements then because the diaphragm is working. As we go into flexion, we're exhaling. As we go into extension, we're inhaling, and all that diaphragm is coming right down, massaging all the organs below. As the diaphragm descends down, then the pelvic floor is able to relax properly. As the diaphragm then comes back up into the rib cage, then the pelvic floor contracts. And there's no real reason to be doing Kegels because your diaphragm can be doing the work for you.
Absolutely. I mean, the pelvic floor is designed to be worked reflexively, and it is being drawn into a Kegel situation all day long when we are breathing in a way that is advantageous. I would add to your breathing explanation that, yes, all breathing is diaphragmatic, but I would say that not all people are breathing in a 360 expansion way. Some people's ribs are so shut down. I see females who have been wearing really tight bras their whole life, or they have very large breasts and have, tried to hide them, or they just carry a lot of shame and tension, or they've just been hunched over. Like, no, it's okay to have these patterns, but as a result, their ribs don't have the expansion. And when we take a deep 360 breath, the ribs are designed to expand so that the belly doesn't get too much pressure and that the belly doesn't suddenly just have all this unmitigated pressure pushing down into the belly, because all that pressure pushes down into the pelvic floor. So when we are learning, when we are observing people's breath, yes, we are looking for the whole canister to expand, but we really want to see that the rib cage has this expansion quality, because if the rib cage is stuck, it's like toothpaste. Everything pushes downward in order to prevent, and then no amount of pessary is going to be that supportive when everything is being pushed down, like plunged downward constantly with inherent tightness and tension of the whole upper body. So really, like you said, the breath is so important, right? Getting that breathing, but it's not just you should be breathing. There is a way to breathe that is more advantageous to creating a reflexive and responsive pelvic floor. So we just have a few minutes left. I just wanted to summarize, and I wanted to get your last thoughts. So if you're just joining us or coming in a bit late, that's cool. But what we've been talking about is how when you have a pessary, best practices is to train your pelvic floor as well, and to be working on strengthening and a responsive pelvic floor system. You cannot just pop a pessary in. Well, you can, but and hope that it will just do what it should without also addressing your pelvic floor physically. I feel like last words from you, you probably can summarize in a better way the things we've discussed. Takeaways.
I think that's perfect what you've just said. I think absolutely looking at everything around with the body, getting a really good instructor on board to help you. Don't be afraid to talk to your instructor about what you're feeling, what you're not feeling. And yeah, I just think it is important to get the right pessary, and don't go on the internet just buying any pessary, because you need to be measured properly. You need to be assessed properly. If you've got any ulceration or anything, it's a contraindication. So you don't want to go off buying anything and making, the prolapse or anything worse. This is a brand new pessary that has been designed by a physiotherapist. It's not on the market yet. It is coming on the market. I've tried it, and it just forms into the area. And what I love about it, it's got the recoil. So even if you're doing high impact sports, you've got that recoil that other pessaries don't give you. So again, this area is starting to develop more and more as we're learning more about pelvic organ prolapse, and there's hundreds of different reasons why we prolapse. So don't ever think that you've done something wrong to your own body. Don't ever blame it on the baby that you've given birth to. Please, it drives me insane. It's not the baby's fault, But the end thing is that you can find a solution, and it's consistency as well. It's not going to happen in 4 weeks. Don't expect anything to sort of, but improvement you can certainly see in 4 weeks. It took me 18 months to go from a grade 2 to 0, and I'm still at a 0 now. So
yeah. And I think somebody is asking, I just want to address somebody who has a few questions. So is a pessary good for healing a prolapse, or is it just symptomatic? That was one question. I think if you're, as somebody who works daily with people healing prolapse, I will say that a pessary alone is most likely not going to heal your prolapse. If you want to heal your prolapse, you absolutely have to look at your patterns, your movement patterns, breathing patterns, core strategy, core gripping, mobility. There's just so much that goes into a prolapse, but it's a lot of downward pressure. And so figuring out what is the cause of that downward pressure is really important. And a pessary is not going to remove downward pressure. So I would say a pessary in combination with, because a pessary in combination with the exercises is ideal. And I would say that for some people, they don't start to heal until they use a pessary. Because when you are feeling prolapse symptoms, it creates insane stress. People like panic around, rightfully so, but they start to tighten and grip around the symptoms. And they start to hyper focus and hyper vigilate. And they're just like thinking about the symptoms all the time and constantly getting stressed and tension. You cannot heal your pelvic floor under stress, tension, and vigilance. And so the pessary can be an amazing tool to remove that blockage, because now you're no longer feeling the symptoms of your prolapse. Your body is calmer, your mind is calmer. And from that place, you can start to find more healing. So sometimes when I have a client who's so vigilant, I will say, I'm going to ask you to please explore the idea of a pessary. I think it's going to downtrain your nervous system, which is what we need right now in order to uptrain your pelvic floor. I don't know if you have that experience, Gaynor.
Yeah, absolutely. And, you know, when the lady, whoever asked, said, will it reduce the prolapse? Don't forget that, let's say you've got somebody at the worst case scenario, which is a stage 4, where the prolapse is completely everted outside of the vaginal vagina. I don't know if I can say that, but yeah. So
vagina. You can say it, vagina.
Well, I've just come out of Facebook jail, so
I'll probably go next. Take me.
But you know, with the pessary in situ, it will reduce the prolapse because it's taken it back up into its natural anatomical position. So in essence, it does reduce the prolapse. But then when you take the pessary out again, there is one clinical study they did actually find that the use of it was a ring pessary over a certain amount of time. They did find that the prolapses in all that trial had reduced somewhat, and they split the trial into those with exercising and those who weren't exercising. Now, what they didn't, I think they made a little bit of a faux pas here, is that they didn't include those in the trial, those women. They didn't ask them, are you on any kind of HRT or estrogen therapy? Yeah. So that can make a massive difference as well.
Huge. It's a big question. Gaynor, one more question I just want to ask. So somebody is asking that they have a prolapse ever since having surgery for prolapse. This is really common, and your surgeon might not tell you that. I am not against prolapse surgery. I'm not against surgery of any kind. I'm not against whatever you want to do with your body. I work with thousands of patients, clients who've had prolapse surgery, who then prolapse again. So if that's happening to you, the first thing I want you to know is you're not alone. This is very common. Prolapse surgery has a very high rate of reprolapse. Secondly, I want you to know that you can still heal yourself. And I have seen some pelvic floor PTs out there saying, once you have surgery, you're doomed. You need to unfollow, X those people out of your life. It's not true. Now, what is true, though, that once you've had surgery, and I've had back surgery for herniation, a prolapse is a herniation. Once you've had a surgery, you are more vulnerable, but that doesn't mean you're more weak. It doesn't mean you need to be into a state of vigilance. It doesn't mean you won't heal. It means that you are now on a journey that's just a little bit more nuanced. I find the fact that I had surgery to be really interesting. It's a whole new interesting place. It's okay, we're now doing that journey. And I think that there is so much, if you've had a prolapse surgery and then you get another prolapse that you weren't expecting, It's common, and there's so much you can do about it. This is not the topic of today's conversation, but I did want to cover that because I can sense the concern for the person who asked. So you can still heal a prolapse if you've had surgery for a prolapse and now you've re-prolapsed. You can still heal a prolapse without a surgery. I've seen many people do it. It is a practice of consistency and time, and you really have to be 100% consistent.
Yeah, I think there's not enough surgeons recommending physiotherapy, or osteopaths as well. Don't forget, women's health osteopaths are amazing. They're fitting pessaries. So if they're not recommending these professionals, then the patient goes away and they're basically left to their own devices. And
and they're not really working on some of the intra-abdominal pressure. As we said, prolapse, hypertonic pelvic floor, incontinence. There's often, and somebody asked about overactive bladder, there is often a compounding effect of excess pressure, which is then compounded more by stress, tension, and gripping, which is then compounded more by lack of blood flow. And when people start to feel these symptoms, they lock their body down. They stop moving. They stop being active. They're more afraid. They leave the house less. They do less physical activities. All of these things then play into the fact that they are still having now more symptoms. And so that's locking them down more. They're doing less movement. They're doing more vigilance. So it just becomes this kind of snowball effect. And you have to kind of be careful not to get, once to disrupt that. If you find yourself in that pattern, you've got to disrupt that pattern. Or you're then again feeling just more symptoms and more symptoms and more pain.
And I think it's also important to let everybody know that, right through our skeletal system, we have fascia. Now, if we don't move, the fascia becomes like scar tissue. It dries out, it becomes dehydrated. Yes. We need to lubricate that fascia. Yeah. Also with the joints, the synovial joints, we need to be reproducing the hyaluron, which lubricates those joints. So the minute that you stop working on your body, you stop working.
Don't listen, if you are in an unconditioned body, that's okay, but you can change it today. And you can change it in baby steps. So Gaynor, we have gone 8 minutes over. I want to honor time. I have a client coming up that I need to get to. I'm sure you do too. So it was brilliant. It's always so amazing to talk to you. I think that I always send people Pessary, I'm like, go talk to Gaynor. You are such a wealth. You run amazing courses. You teach Restore Your Core. You are so appreciated. Thank you, really.
Well, likewise, absolutely, because without your training, I wouldn't have spotted any of these things that I can help clients with now. So, I absolutely love, Restore Your Core program. I did it before the teacher training. I did it to help my own body, and it's just, it's a premium, platinum, whatever it is. I don't know. I've got no words for it. It's just a fantastic program.
Thank you. I'm happy to hear that. Thank you. I appreciate that. And we will chat more. People love it when we get together. So we're going to do this more. Thanks everybody for joining and your presence. It's always so appreciated.
Thank you.
Bye.
Bye.